Well, let's get some immediate reaction from Labour here at the conference in Liverpool. Wes Streeting is the party's shadow health secretary. Hundreds dead, thousands injured. What is your reaction to this assault on Israel by Hamas?
Well, there can be no justification whatsoever for the barbarity we've seen unfolding on our television screens and social media feeds. I cannot imagine what people in Israel are going through. And when I say I can't imagine, I mean I literally cannot imagine it. The murder, the violence, the kidnapping, the parents having to explain to their children what is going on and why they are fleeing for safety. And that is why it has to be unequivocally condemned, why we unequivocally condemn the violence. And, you know, I think for the future of both Israelis and Palestinians, there is no future that involves this violence, this bloodshed. And I think for our country, for other democracies around the world, it's important that we stand with Israel, Israel's right to defend itself, and hope that in the aftermath of the bloodshed and violence we're seeing unfold on our television screens, there might still be some hope of a way through that sees both Israelis and Palestinians living with peace and security and freedom. But that future feels a long way away from what we're seeing unfolding now.
I know you know Israel well. I believe you spent a week or so last year studying the health service. How much do you think this has set back any progress towards peace in the Middle East?
I mean, I think it's early days. See how things unfold. It is hard to see how, off the back of this, you get to where I think we ought to be, which is a peace initiative, ideally one that's led by the Arab League, to bring together Israelis and Palestinians around the table to negotiate what I still believe is the only solution to this conflict in the longer term, which is the two-state solution. But it's hard to see how what we're seeing unfolding on our television screens doesn't set back that cause, that hope, that prospect for a peaceful solution where both Israelis and Palestinians can live with the freedom, the security that any of us would want to enjoy, and the hope of a better future.
Well, we shall see how this rather incredibly grim scenario unfolds. I'm sure that we'll be reporting on it for days. Of course, you have your responsibilities here, and you will be talking to the Labour conference about your plan for the health service. But before we get into that, I spoke to Labour's, I guess, biggest union donor, or the head of Labour's biggest union donor, Sharon Graham, the boss of the Unite union. And I just wanted to show you what she said about you, really.
OK.
I'm going to keep Labour's feet to the fire. Of course I want a Labour government. I absolutely want a Labour government, of course. But I want a Labour government that is going to make real change to people's lives. And I think at the moment, Labour are being too timid.
So, how do you respond to the suggestion that you're just too timid?
Well, let me just take the NHS as an example. We've committed to the biggest expansion of NHS staff in history to give the NHS the staff it needs to treat patients on time. We've committed to having dedicated school counsellors in every primary and secondary...
I want to come to that.
No, but this is important, Trevor, because let me just outline
I'm going to give you a chance to explain all of that.
But the big... And I'll come back on the detail, but look, just to outline the ambition. A school counsellor in every primary and secondary school in the country, community mental health hubs in every community, a plan that would create 2 million more appointments a year to get the backlog down, which we've announced this weekend, doubling the number of CT scanners and MRI scanners to get people diagnosed and therefore treated faster, a plan to create 700,000 extra dentistry appointments a year. If we delivered just one of those policies, it would be transformational in terms of people's experience of healthcare in this country. Taken together, they form the basis of a serious plan to grip the worst crisis in the NHS's history and build an NHS that's fit for the future. So we've got the ambition, we've got the plan, we've got the team. and now we've got to make our case to the country to get them to vote for it.
Let me say, I mean, I can't exactly channel Sharon Graham, but I guess what she would say if she was sitting here is, yeah, it's all very fine, but actually, big thing right now is energy, cost of living. You're not doing very much on that. What you really need to do is nationalise the electricity and gas industries, and we're not hearing anything from Labour on that scale.
We've gone one better to deliver real change for people, which is we've committed to a real windfall tax on the big oil and gas giants and their excess profits, which would deliver real help to families now in terms of the cost of living, and an ambitious plan through GB Energy and through the enormous expansion of both new nuclear and new renewables to create the energy security, the jobs, and the lower bills that Britain's crying out for. That's an ambitious plan. It's a credible plan, and it's a plan we're going to make our case to the British people to vote for.
So you're not bothered by the reports that her view is actually shared, you know, the view that you're basically a bit wet, is shared by some old Blairites like Charlie Faulkner and Alistair Campbell?
I don't think that's a fair characterisation of their views. And
you can read what they said in the newspaper yesterday.
I think when you look at where the Labour Party was when Keir Starmer became leader of the Labour Party, an existential crisis for this party. Will Labour ever win again, is what people were saying. Will it even exist into the future? He's taken the Labour Party from the ashes of our worst defeat since 1935, dragged the Labour Party back to the mainstream, and has built a team and a platform that can give Britain its future back, and is building public support on a scale the Labour Party hasn't seen since it was last heading towards government.
Nobody's going to argue, I think, about the case that the Labour Party has been straightened out. Things that you were criticised for have now, in some senses, been solved. But what we're talking about today is the possibility of a Labour government. And what I think people want to know is, what does that mean? Now, you've put some flesh on the bones this weekend. You announced that you spent £171 million on new scanners for the NHS so that we can get ahead of cancers, rather like the one that you yourself unfortunately suffered from. We're hearing this morning about £1 billion to pay for extra overtime so that those scanners can actually be used. Now, the NHS has got a budget of £200 million, a staff of 1.3 million. This doesn't really match the scale of the disaster that you've been telling us about for a year that the Tories have wrought. I mean, it really is a bit of a mouse, isn't it, compared to what you've said is a terrible, terrible destruction of the NHS.
As I'm going to be outlining in my speech at conference on Wednesday, the way we make the NHS fit for the future isn't simply investment, it's reform. And I would argue reform is even more important than investment, in the sense that if you just keep on pouring ever-increasing amounts of taxpayers' money into a system that is failing, it's wasteful in every sense.
So what's the big reform? What is the big reform?
When I compare the NHS to other healthcare systems around the world, and I look at why our outcomes are so much poorer, it's because effectively we do late diagnosis, which means more expensive, less effective treatment. We've got an NHS that is effectively a hospital-based sickness service. We need to rewire the NHS so we do far more primary care and care in the community, faster diagnosis, faster access to general practice, more care in people's homes, and dealing with delayed discharge at the exit door of hospitals through social care. And unless you've got the reform argument, what you do is just pour more money into a system that isn't working, and you waste taxpayers' money.
I want to come and ask you in a minute about what you've just said about social care, but let's just deal with what you have actually said you want to do, and because I wonder if it really matches up to the task and whether you can actually do it. You know, what you said, you're going to spend this £1.5 billion on overtime, on weekend working and so on. We looked at the NHS's own staff survey, and here's what their staff say. 34%, 1 in 3 NHS workers, say they often or always feel burnt out because of their work. 31%, 1 in 3, say that they feel exhausted at the thought of another day's work. You are not going to get people to do overtime. This is wishful thinking.
No, the reassurance I can offer people is two.
Well, you can't offer the reassurance. How are you going to... The people who have to do the work...
Well, you don't know if I can't offer reassurance. You're not giving me a chance to say it. There are two reassurances I can offer. is firstly, this is not compulsion. This is voluntary. Staff will give them the choice to opt in.
I'm not asking about that. I'm asking how you're going to get people to staff those scanners.
The second reassurance is that the reason we've adopted this approach is because it's an approach that is already been shown to be working in some London hospitals. But I want to take the best performance in the NHS, the extraordinary performance in the NHS, and make it the everyday experience, the ordinary performance right across the country. We can't just have an NHS that's performing well in London. It's got to perform well for the rest of the country. It's a credible plan. It's workable. It would create 2 million more appointments a year, and that would be game-changing in terms of getting waiting lists down and busting the Tory backlog.
You're trying to sell it to me, but let me tell you what somebody else said about this, about the NHS's staff. Looking at the fact that, as Labour said, they're doing 1 million hours overtime a year last year. The country is in their debt after their astounding sacrifice and commitment during the first wave of COVID. But now, with what's likely to be the toughest winter ever seen in the NHS, they're being asked to give even more. You know who said that?
John Ashworth.
Exactly, your predecessor. He says we can't ask staff to do more. Now you're turning up and saying, oh, by the way, we want you to do even more. We want you to work at weekends. We want you to work at evenings. How are you going to make that happen?
Well, as I say, Trevor, it will be voluntary for staff. They will be paid.
And they will say,
they will be paid fairly. Some staff won't want to do it, and that's fine. The plan to deliver 2 million appointments doesn't assume anything like the majority of staff are going to be piling in to do this. What matters is that we can get the staff we need in every part of the country to help us deliver 2 million more appointments. Of course, we've also got to deal with the underlying pressures that staff are facing that are leading them to walk out on unprecedented industrial action, because the risk for the future of the NHS isn't simply they walk out for more strikes, is they walk out of the NHS altogether. We've got a retention challenge in the NHS, not just a recruitment challenge. I get it, but this is a serious and credible plan to deliver 2 million more appointments, and I think staff will be proud to deliver those appointments. Patients will be grateful to receive them. I
want to return to what Sharon Graham said. You said this weekend that you're calling on decent Conservatives to come to Labour. They have a home in Labour, to quote you. Of course, some people in the Labour Party think that's what you really want, which is to turn the party into a comfortable place for red Tories, I think they call you. Well, like yourself.
Look, I'm very proud of the fact that the Labour Party is appealing to the country rather than repelling people. And my goodness, that change couldn't have come at a better time, really. When you look at the cranks, the crackpots and the conspiracy theorists that have taken over the Conservative Party, when you've got cabinet ministers, notionally serious cabinet ministers like Mark Harper on your programme this morning, peddling conspiracy theories as if he's been doom-scrolling TikTok trying to find the most
I will ask him about
bonkers things to say from the conference platform. What are these people doing? And how on earth does this address the biggest crises in our country, the cost of living crisis, the NHS crisis? And here's the kicker for Rishi Sunak. He can't be the change the country needs because his government, as 13 years, has been part of the problem. Only Labour can give Britain its future back, and that's the case we're making here in Liverpool this week.
Wes Streeting, we'll see how Mark Harper reacts to being described as a bit bonkers.
Well, tell him he should apologise and tell him to get his act together and start behaving like a serious government with the little time they've got left.
Wes Streeting, thank you very much for your time this morning.
Thanks very much.